You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. My first guest says, no more dentures. Get a fixed set of teeth in possibly just a few appointments. With us, we have an expert on the topic. He's a periodontist, Dr. Davenport. Dr. Davenport, welcome to the program.
Thanks for having me on, Randy.
Now, before we get into today's topic, and I have a lot of questions, and I know you brought some before and afters. For people that don't know what a periodontist is, I mean, who's your typical patient, and what are the different procedures you do?
As a periodontist, we generally have patients that are referred in from their general dentist for a variety of things. Most of those are related, of course, to gum problems, periodontal disease. Patients will come in with teeth that feel like they're moving, teeth that may be tender, swollen, puffy gums, redness, other things like that. And of course, our specialty is to be able to diagnose, prevent, and treat periodontal disease. Happens to be the #1 reason for any of us to lose a tooth.
So you help reverse that. I mean, people with bleeding gums, bad breath, loose teeth, you can get rid of that.
Most definitely, most definitely.
Okay.
Well, all the aspects of dentistry, we are the ones that are trained, specifically trained to be able to do that, for our patients to keep their teeth. And another aspect, which is really becoming a very large aspect of what we're doing, is with dental implants, giving people back teeth that they may not have had before, or in a traumatic situation, if they're faced with losing a tooth, doing something to be able to give them a tooth back.
So no more dentures. You know, I said that at the top of the show. Is that the future, possibly?
It is. It is.
You believe that?
And I do believe that. I'm a firm believer in that. You know, some of the misconceptions that patients have, I think, is that they may have to have one implant for every single missing tooth, and that's not the case at all.
Okay.
We can do something as simple as 2 implants, have a lower denture which will lock and hold on, and be able to provide good functioning teeth with as simple as 2 implants.
It does seem painful, though.
It does, but you know, that's not one of the things.
I mean, even for a denture wearer, I mean, to go in and get dental implants?
It's surprising. That's not one of the things that they complain about.
Okay.
Oftentimes it's nervousness, it's how long it's going to be before they get their teeth. Pain is not one of the top 5 things that anybody complains about.
So the bone, because there's just no feeling in the bone?
The bone itself does not have nerve fibers, so we can do a lot of things to be able to go through to provide replacement teeth without making incisions and cutting in the tissue. So believe it or not, the procedures that we do really don't induce a lot of tenderness. Ibuprofen, Motrin is the #1 medicine for our patients, and that's just me not saying that. That's them reporting that to us.
And you said today, and I should mention this, and I'll let you answer it, is you said it's more than just dental implants.
Yes.
Elaborate on that.
Yes. Well, when we meet a patient, we're looking for a number of things. All of us are faced when we're meeting somebody, whether it's a friend with a handshake, a family member with a hug, we're using our teeth and our smile. And that's a really important component for all of us. Aesthetics are definitely something that is very, very important. Honestly, it should look like the dentistry was never done. And that's our goal as dentists. I work with a fantastic group of people who we work very closely with, good laboratories, but we're trying to be able to create something that doesn't look like it's done. These aren't chiclets, these aren't teeth that look like they are plastic teeth or replacement teeth. These are normal, natural looking teeth. And fortunately, with today's technology, we can do that on a regular basis.
Now, the people that are getting dental implants, they don't need a referral to go to you. And you're a specialist. Does it cost more to go to a specialist?
It does not, no.
So why not? You know, people always say, you know, give me a recommendation, Randy, you know, a referral. And my site, wellnesshour.com, is not a referral site, but I say go to a specialist, right? And this is one of the things that you do. And if it doesn't cost more to go to a specialist,
well,
why not?
I think they don't know. They think that seeing the regular dentist, that they're going to be able to do everything for them. But honestly, you know, medicine itself has become very specialized, and so is dentistry.
Okay, now dental implants, I guess it's now you hear like teeth in a day or same day teeth or same day smile or whatever, you know, teeth in an hour, all of those things. I guess that's possible, right? I mean, for certain candidates, you can do this right away.
We have the technology today to have a patient come in our office, somebody that may have been wearing a denture for 30 or 40 years. We can get an x-ray in the office. We used to send them out to a scanning facility, but today we have that technology in our office. We can take an x-ray. And that x-ray itself is a 3-dimensional picture. So it allows us to look at things in much more in depth
it's like a
than we
CT
ever
scan.
had. It's like a CT scan, it's a cone beam tomography. But we're able to look at things in 3 dimensions. So we don't have to kind of guess and see where the bone may be or what, you know, what issues we're facing with the anatomical structures. We're able to look at all the parameters ahead of time. And we can look where they have quality bone support. We can look maybe where they have deficiencies. We don't necessarily have to go through all the bone grafting, the other things that we used to have to do.
Now, in the old days, you know, because we talked on the telephone that it was a lot more cutting to the gums in the old days. That's
Yes,
why the pain.
yes,
But now,
yes.
because of imaging,
Exactly.
it's very precise.
All that is kind of gone away. Years ago, what we have to do is make an incision and kind of look and see where our patients had the best bone support. And then we would make an idea of where we're going to place our implants. Today, with that imaging, we're able to actually do that without making incisions, without cutting, and be able to visualize and see where that bone is ahead of time. The computer software, Randy, also allows us to go through and be able to do planning with our implants right on the patient. So we can actually sit without the patient there with a good scan and do the entire surgical procedure right in my office, which is it's fantastic.
So that's why it's so quick now.
Yeah, yeah.
Okay. So what is it that you said? I mean, this used to take, I guess, 9 months or so.
Sometimes longer.
To get dental implants.
Yes.
And some of that still goes on today. I had a doctor on the show that said, I'm waiting. He was a medical doctor, and he's waiting about 8 months to do it.
Yeah.
I said, I think that's kind of maybe outdated, or you need to modernize whoever you're going to. What are the age ranges of people that are great candidates for dental implants?
You know, it's interesting. I do get that question a lot. We're more concerned generally on the younger patients where somebody is in their teenage years and maybe didn't get their secondary teeth. Those we have growth and development of the jaws, and we want to make sure that they're mature enough in order to have a good cosmetic smile afterwards. So it's the younger patients that we tend to have more questions about. As far as
like 18, 19, 20?
Yeah, somewhere in there, 16, 17, 18.
So instead of having, even in the front teeth,
exactly,
you do these.
exactly.
Okay. So instead of having a flipper or whatever,
yes, we can go through if
Okay.
about 5% of the population doesn't get a secondary tooth through there, a lateral incisor. Instead of doing bridge work or moving other teeth into the position with an orthodontist, we can go through and we can give them something back that they never had. Okay. Which is really, I have a young girl I just saw a few days ago, for a college-age student, wearing removable teeth is just not an option anymore. I mean, she's got a whole life that she wants to embrace, boyfriends and all the other things, but she wants to have something back, and that's what we work with.
And the older patient, I mean, what's the oldest patient?
You know, we have a patient, I believe she was 96 years old, we finished.
For dental implants?
With dental implants.
So why would she want to do that, though,
well,
at that age?
She wants to be able to eat and chew and feel comfortable with herself and smile. She wants to be made whole. She doesn't want to go around with a removable tooth. 96.
So is there more likely to fall out at that age, by the way?
Not at all, not at all.
Really?
The bone itself and the healing on a patient, as long as they're a healthy patient, healthy enough to sit in the dental chair and have dental anesthetic, she should do very well with that.
I've mentioned to other guys, my own mother, knowing that, I interview doctors about this, that she says, at 75, my doctor said I'm too old. Mm-hmm. Is that common, you think? There's some people out there that think they're too old?
We get patients who question. They may say that they're in their 60s, their 70s, and they're too old for dental implants, and that's just a fallacy. It's not true. We can do things. We can actually provide good level of care. They can function. They can chew. They can eat. They can have a quality of life far better than with having a denture. So the age itself is really not any type of contraindication for having a dental implant. And another good point is, 70 and 80, 90 years old, these are not that old of patients any longer. These patients can enjoy eating the things that they want to eat. They can enjoy salads. They can enjoy fiber. They can chew things that, without dental implants, they really have difficulty doing.
So the denture wearers, and I know a few denture wearers, and they don't complain to me. Obviously, they're not going to tell me their problems, but you must hear all these stories. So they can't eat salads.
They have
difficulty, or fiber, I guess.
Yes, yes. They have difficulty eating all the things that they should eat, and they know they should eat. The fibrous things are going to help them, help their GI, help their system. If they're a diabetic, of course, there are a number of things that they should be eating. Again,
so the doctor tells them, you're borderline diabetic. Here's what you have to eat, but they can't eat the food.
Yeah, the doctor, when a diabetic goes in, they talk with their doctor, and of course they're looking at different levels of what their blood sugar is and shouldn't be. The doctor has a couple of choices. He says, well, we're going to increase your medicine if your sugar's off, but we want you to eat this and exercise. Well, when it comes to eating, I don't think they realize that the patients have such difficulty in doing that. So it's really a far different situation after we do some implants where they can actually enjoy the foods.
Do you hear the stories where the patients, after it's all done, say, I guess two things, I should have done this years ago, or do they tell you their eating stories?
All the time. I had a gentleman the other day, he had lost 31 pounds. He thought that his knee would need to be replaced. He was having a lot of arthritic issues. He said, Doc, I got my implants, I'm now chewing and eating the foods that I want to eat. I'm able to enjoy life, and I don't have any problems with my knees anymore. So just a whole quality of life. And you mentioned one thing there. that's the one thing that we hear all the time. I should have done this years ago. I shouldn't have waited.
Is that right? They say that
all the time, all the time.
And then
it's wonderful for us to hear that. It really is.
Okay, good, good.
It makes us all feel so
You'll
good.
work with their regular general dentist. If somebody has a general dentist, I mean, you work together as a team.
Correct.
So they don't have to switch dentists.
No, no, no. We work together with a very high quality group of doctors. I'm fortunate to be able to work with a number of docs that just have great clinical skills, but we work together as a team.
So even if they have a denture and they have a dentist that they go to, I guess, for those relines or whatever, you can work with that person and give them some implants.
Yes, yes. And oftentimes we can actually use the same denture they have, but we work together as a team. We share x-rays and different...
How do you use the same denture they have?
Well, the denture itself may not be the problem. It's the fact that the denture, and I have one here.
Okay, okay.
If we see what a denture is, once this is in, this shows a lower jaw, and if this is in, with there's no teeth, this is actually a moving the jaw, the moving jaw itself. So as the denture is there, it's moving back and forth. We're actually able to take the denture. This shows 2 implants on the lower jaw, and they have some connections on top of that. In the denture itself.
Let me see that. So there's little snaps, little holes. Okay. All right.
So in the denture itself, we have a connection. So this is a male that sticks out, and this is a female, and this goes in. If we can listen to this, Randy, it locks into place.
Let me see this. And is this accurate? I mean, this is about how
this
tight
is accurate. This is a lower jaw.
Do they ever have, I'm not exaggerating here, but do they ever have, I guess my hands are a little greasy.
They do. They have difficulty.
So they get a full arch of teeth, 2 implants, snap in, snap out. No
Correct.
adhesive?
No adhesive, and that's one of the biggest enjoyments that our patients have. You know, people report to us they get up in the morning, if they have their denture, they have to start their whole day off by putting these creams and lotions, these sticky types of things, these adhesives to hold the dentures in place. With dental implants, we don't need that. The denture itself locks into place and is held in place by the dental implant itself. So no more creams, no more lotions, no more potions.
Okay, tell me this.
With all that.
There's got to be 10,000 denture wearers plus in all of Georgia, right?
Probably many more,
Like hundreds of thousands maybe of denture wearers, upper or lower. If it's so good that just 2 implants, snap in, snap, why aren't they all doing it? What's your take on that?
You know, that's a good question. I think they're just not aware of what their options are. Most of these patients, unfortunately, have probably not seen a dentist in many years.
Okay, good point.
Leading up to
they don't have to go to the dentist if they don't have
teeth. They have no more teeth, even though they should. But leading up to that, they either had teeth that were removed or old bridge work or cavity, so it probably wasn't a pleasant experience getting there.
Okay.
And then they have dentures that they just don't fit. You know, we have patients that come in and they have bags of dentures, and this one was made here, this one was made here, again. What they don't realize is that it's not really the denture itself, it's just the fact that it has no bone support. So the denture itself can be a fine functioning denture, but it doesn't have any retention. There's no way to stay in the mouth.
Is this true that all denture wearers are losing bone during this process?
Yes, yes.
Explain that.
The bone is melting away when a tooth comes out. So the physiology, the body realizes that if the tooth is no longer there, the bone just starts to melt away. Once the denture is in place, it's hard acrylic. So as they're using those, they're working with the denture and they're actually causing pressure on that bone support, and it continues to melt away. It doesn't stop. If we go in and we place a dental implant, we actually stimulate the bone support the way the natural tooth does. So we don't have that. So the facial structures and things that are changing, we stop that whole process and give them something back.
Now, one of the things on the phone that stuck out to me is that you say some people think that they, or have even been told, they don't have enough bone.
Yes.
They're not candidates for dental implants.
Correct.
And they are in your office.
Correct. Well,
how can that be?
Well, as we talked about earlier, the imaging itself, we're able to see things much more today than we ever had. We're able to look with an x-ray and see where the best bone support is. And again, the technology has changed, so we can do more with less implants today.
Do you have patients right now that have a full arch of teeth secured by dental implants that were told elsewhere they couldn't do it?
Oh, yes, yes.
Is that right?
Yes,
really?
Yes.
I know you want to be positive and you don't want...
My mother's one of those. My mother,
really?
In the 80s, started, and when implants were first becoming popular, she went to dentist after dentist, and they all told her she couldn't be a candidate. We had a scan
Why
done.
was your mother going to other dentists? You guys lived in different
it wasn't
states?
before, this is years ago.
Oh,
this
before,
is in the 80s before I was
before you
actually
became a
doing
dentist.
this. Yes.
Okay, good.
I was still in my early training, but you know, things were early on at that time. So she went through and she had heard about this. There's segments on, you know, Good Morning America and all these programs. This was the new thing to get rid of dentures, and time after time again that you know, she was told again and again and again.
Not enough bone.
And she was very discouraged. And to get her into my office and to get her to go through a scan and talk to her about what we could do, that was really a life-changing experience for her. It really was.
Wow, good for you. Now, we should also mention, because people, like you say, you know, one of the reasons why everybody's not doing it is their fear of the dentist. You do sedation.
We do sedation.
One of the things periodontists do is they do sedation.
Correct.
So they don't know the procedure happened. It's like an amnesia.
Well,
and what type of sedation is it?
There are a couple of ways. The most common way that we do that today is by giving them a pill. It's Triazolam. It's a medication which is a sedative. It's in the same family as Valium. We can give that to our patients about an hour before coming in, and they start resting comfortably. So we can go through and do our procedures with Novocaine. They're not feeling anything. The most beautiful thing about this medicine, though, is it has an amnesic effect to it. So they don't remember anything about the procedure itself. They go home with some long-acting numbing medicine, they have a nice nap, and everything is finished and done. So it's a big advantage, particularly for those patients that have fear or they've had bad experiences in the past.
Now, these denture wearers, by the way, that you meet, are they ashamed of their denture? Like they don't smile because of it? Do you hear that?
I do. I think
you see it. They cover their mouth.
Fit, their hand comes up. It's something about them. I think in their mind they may think that they project a certain way, but they end up kind of compensating, and you know they may just not feel quite the way that they project themselves, or they think they should feel.
So how important is the smile? Now you're a dentist, you're a periodontist. Of
course.
You probably think that, let me guess, that the smile is one of the most important things, but how important is it as you see it? In this economy, any economy?
I am sure I have my own bias, but you know, we were talking earlier, and you meet a new person, a handshake, a family member, you know, a hug. We still have that portion of us, which is our smile, and it's so important.
All right.
You know, People magazine, that's something, of course, any dentist's office, a guilty pleasure at my house with my young daughter and wife. Right. They do a whole segment on the nicest smile. And, you know, it's just such an important part of all of us. And I think it's a way that we project who we are.
I mean, definitely in a job interview. I mean, two people, one's smiling, one's not, with the same background, training. The smiley person seems positive, et cetera.
Yes, and we can see probably who's going to be able to get the job and win the points there. But a smile is very, very important. I think all of us, if we have a nice smile, we may take that for granted. But for people that don't, I think they're limiting themselves, and they can do a lot more to change that.
Now we're just about out of time, but you brought photos. So what are we looking at here?
Yes. We have a couple of photos here with some wonderful patients.
Okay.
She didn't like her smile. She was very concerned. She was missing a front tooth. She had some older dentistry, some older bridge work, very worn types of teeth. The teeth themselves were aged. She showed that dark line right at the gum tissue line. So we're able to go through and do some combination of some dental implants as well as doing some other types of veneers and cosmetic things. We're able to give her a far different smile. So if we look at the before and after, we can see just a marked difference in these patients themselves.
So which one of those is a dental implant on the after?
Good question. I was just going to ask you that. It's right there.
Okay.
Yes.
To the left of the front tooth.
The left of the front tooth, exactly. And now we can see that the smile itself follows the lip line. We have very nice color. Most people would not be able to tell that there's a dental implant, or really any dentistry has been done. And I can guarantee you that this patient now gets a lot of compliments on her smile.
Let me take a look at the face over there.
And this is an after of that too.
Oh my goodness.
A before and after, and what a difference there. And this is a subtle change, but it's a dramatic change at the same time.
It is different. I mean, she looks almost more sophisticated.
Sophisticated, confidence. She's a business person. I'm sure this helps her business every day, helps her how she feels about herself every day.
Okay, good, good.
Here's another patient. He represents thousands of patients, if not more, where he's wearing a flippers. Flip it in, flip it out.
Is that for one tooth or a couple of teeth?
This happens to be for one tooth.
Okay.
He hates this. He hates it. Every day of his life he hates this thing. It happens to be a front tooth. So we're able to actually get rid of the flipper itself and do a dental implant, something that looks very nice and cosmetic. And if we see in the after, we have a beautiful smile by doing some simple things.
Very nice.
He was able to really change quite a bit about himself in really just a few short appointments. So very, very nice with that.
Good.
Have another patient here, very, very nice lady. She doesn't like her teeth at all. As she's chewing and eating, her teeth are moving. They're very uncomfortable for her. And we're actually able to go through with taking her teeth out, and again, in a few short visits, be able to give her dental implants, we can see in the after.
Okay.
And really create just a complete different environment for her. She now enjoys food. She's lost a tremendous amount of weight. She feels good about herself.
Do they tell you that, by the way? Why? Because they're just eating better food.
She feels good about herself, yeah, and she can eat the right things.
Right.
She's able to enjoy really the quality foods, the things that she needs to eat to make herself healthy, and she feels good about herself.
What if somebody watches this and says, yeah, my gums are too bad? I have terrible gums.
You know,
are they not candidates for dental implants?
No, it's you know, the gum tissue itself is irritated from an infected tooth, and once the tooth comes out, that gum tissue goes back to a healthier state. So we can actually do something in a healthier environment for the patient also.
Okay, so the gums can't be too far gone to get dental implants?
Not at all, not at all.
So
we want to be able to clean the gums up, and we can do some things non-surgically and get the gums in good order. If the tooth has to come out, the tooth can be removed, and then we can go through and do a dental implant. But then we're in a healthier situation.
Okay, good. Now, if you're just tuning in, we're talking about no more dentures, get a fixed set of teeth in just a few appointments. With us, we have a periodontist, Dr. Davenport. And now you've done a lot of, we haven't talked about your training, but I mean, you have extensive training when it comes to dental implants.
Yes, yes. I was very fortunate when I first started in my early training. Dental implants really hadn't been done so much. This was the early 90s, mid 90s. Some practices were just starting to incorporate that. But in my training institutions, this was something that was a regular thing. So as a periodontist, our training is far different than, say, the general dentist. We go on with additional 3 years of training and education, but implants for me were really from the beginning to start with.
Because you're the surgeons. I mean, you're used to this.
We are the ones that are doing the surgical procedures with placing the implants. We have a vast knowledge of the anatomy, the bone support, everything else that really encompasses the maxilla, the upper jaw, as well as the mandible, the lower jaw.
Okay, you have probably time for one or two more photos. What else do you have there?
I have a wonderful patient. She is a unfortunate denture wearer for many, many years, about 40 years of her life. She had been living with dentures, an upper and lower denture. She had problems eating, chewing, being in public. This is just something that she was very concerned about. She had actually gone and talked to a few people, and they told her she didn't have enough bone support for dental implants.
She was told she couldn't get dental implants?
She told that it would be a big procedure.
Does that frustrate you, by the way?
It does, it does. But fortunately, she got into the right hands. We're able to do some things with her. We actually did a three-dimensional scan on her. We're able to go through and put some implants in. And Randy, I want you to notice in the photograph here, look at her upper and lower lip. See how much there's a curvature through there? See how much she looks like she's aging or aged? We just don't have really any lower third of the face at all. Because there's nothing to support.
She's losing bone?
She's lost bone. She has nothing to support her lips. She has nothing there at all. And if you look at the after, it's a complete different environment. She now looks happy. We have fullness to the upper lip.
The lip is out there.
Lower lip. And she looks probably 20, 25 years younger than what we saw in the first.
Okay, good. Good, good. Now, okay, so a recap. Okay, so denture wearers. 2 implants, snap in, snap out.
Correct.
They could get 4 implants for a little bit more stability, maybe 6 or so for fixed.
Yes.
I mean, they don't come in and out. Isn't that what everybody wants?
That's what everybody wants. It is.
Okay.
When we talk to our patients, if we can get back what they've lost, if they're a denture wearer and we can get them back something where we have enough implants, where they have something that doesn't come in and out of their mouth, they are very, very happy with that. And that's really what people would like. That's dependent on the amount of bone support, but that's usually something we can do with our patients.
Now for the upper, and we're talking about a fixed set of teeth with maybe 4 or 6 implants, maybe 8 implants. No roof of the mouth is covered.
Nothing on the palate, nothing is covered there. They're able to chew and function. They can taste their food again. One of the biggest challenges with any denture wearer is the fact that the roof of the mouth is covered. And this, they don't have that. That all goes away. They have teeth that look and feel like their own natural teeth. They can chew and they can taste their food. Ice cream, surprisingly, is a big one. And coffee. People that want to drink coffee, if all that's covered with the roof of the mouth with plastic, then they can't enjoy that. These are the things that patients tell us.
Is that right? So the little things in life that
The little things that mean
do they even
all
forget,
so much.
like maybe they don't realize how much the roof of the mouth mattered until they get it done?
Yeah, I think they've adapted over the course of some time, some years, and that's just something. There are salivary glands there. There are other aspects. It's the taste and the feel of our food, and that's a really important aspect. And I think they've just kind of lost that, or they've forgotten that, and we're able to give that back by getting rid of that plastic.
So you're not too old to get dental implants.
You're not too old to
So
get dental implants.
A 96-year-old woman went in there and got dental implants.
Exactly.
Very interesting, and we're out of time. Final message: somebody watching this, maybe they're afraid of the dentist, but they've been told their teeth have to go, and especially to the denture wear.
Yes.
What's your message to them?
I think they owe it to themselves that they need to realize that there are other options with dental implants. This is not a luxury. Our teeth are something that we're given biologically, and if we're faced with losing those, we can do something today that's very conservative, oftentimes very economical with the 2 implants we were talking about, and giving something back to really have a new lease on life.
And insurance doesn't cover this for the most part.
Generally not.
I mean, that goes for everybody in the U.S.
Correct.
And I know that Canada's the same way.
Yes.
But you'll work with them. You have payment plans.
We work with them. We want to provide the best quality care.
So make the call. I guess that's the main thing. Go in, get a consult, find out your options.
And yes, I think they deserve it to themselves. I think any spouse would want their other spouse to do that. I think any grandchild would want their grandparent to do that. They'd be able to go through and have, again, a conservative procedure to give something back, and it's really going to be just a life-changing idea.
And every one of them says, I should have done this years ago.
They all say that.
Is that right?
Yes, they do. I haven't ever had a complaint with a dental implant, particularly with a denture wear. It's something that there's just a different person.
Is it the happiest group of patients in all dentistry, periodontists that you've?
It's interesting you mentioned that. I think it is. These are patients when we first meet them. They come in and they're kind of gruff, and they're not sure kind of what we're going to talk about or what the procedures are. We come back, they bring us cookies, they talk to the ladies in the front of the office, we give hugs. It's just wonderful, they really are. They're just such a happy set of patients, they really are.
All right, good. Okay, I want to thank you for coming on the show. Great stuff.
Thanks for having me.
And they could look at these photos on the website, make an appointment with you, and you'll see them one-on-one.
Yes, I do the consultations.
Do you dress like this
myself.
at the office, by the way?
Usually in scrubs sometimes. Like
Is that
this.
right? Okay,
yes.
well, thanks a lot. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again, you could go on our website at wellnesshour.com. If you want to make a comment about this particular interview on Twitter, it's #@TheWellnessHour. For now, I wish you good health.